So let's look at the os coxa disarticulated and the different components and bone markings. Now, embryonically, the os coxa started out as 3 distinctive bones, and they merged together, and the merge point is right in the middle of the acetabulum. So the first bone that makes up the os coxa is known as the ilium. It's the big wing-like portion that's on the superior aspect of the os coxa. Now, for the ilium, we have several features that are important. Here on the medial surface, it's very rough. This is where the sacroiliac joint forms, and we call this the auricular surface. And if you look at it, it sort of does look like an ear. So the auricular surface is towards the posterior side, and you can see there are a couple of bumps here. We call these the superior and inferior, posterior, superior, and inferior iliac spines. And we also have some on the anterior side, so these are the anterior superior iliac spine and the anterior inferior iliac spine. On the posterior side of the ilium, we also create something called the greater sciatic notch, which allows our big sciatic nerve to pass from our vertebral column down towards our lower limb. We also have the iliac fossa, which is a smooth depression on the medial surface of the ilium, and the iliac crest, which is the wing-like portion, the superior ridge that forms. The middle bone that forms, and I always tell students this is kind of the part that you sit on, this portion of the os coxa is known as the ischium. So as it developed, it's more of the inferior and posterior component. It has a couple of features: the ischial spine, the lesser sciatic notch, and the ischial tuberosity, just a big, rough bone marking where muscles attach. So iliac spine, lesser sciatic notch, ischial tuberosity. And then the third and final component of the os coxa is the anterior piece. So this portion is known as the pubis. So it's literally facing the pubic area. So on the pubis, some important features are the pubic tubercle, little bump here, and the rami. So remember from the skull, ramus means arm-like. So we have a superior and inferior ramus that reach out to either the ilium or the ischium.